Learning a variety of sideline techniques and treating in sideline is something that's really important when we're talking about sport massage. Now, as we know, massage is typically this top-down kind of thing, but with sideline, it creates a lot of dynamic movement that's similar to the sport. And it also opens up a lot of different techniques that you can do and different ways to move the body as you're trying to work through a lot of tight muscle and discover what's going on with the client. The next protocol after working in the iliac crest here is to go up on either side of the rib and open up this area. So this one, you can get really active with it. So Jeremy, I'm gonna get you to bring your arm like this. And then, bring your arm like this. And you're kind of anchoring down with a soft hand. So you don't wanna put a lot of pressure on this area. The rib cage is here. The lower ribs are very sensitive. So definitely do not place a lot of pressure here. And what I'm gonna get you to do, Jeremy, is I'm gonna get you to bring your arm up like this. And then as he does that, we're gonna go up either side of the rib cage here, but we're focused on just taking the tissue here superficially and we're spreading it out, creating more stretch in the tissue and more range of motion for this, the latissimus and for the rib cage. And to also open up along this kind of diaphragmatic area. Okay, Jeremy, so I'm gonna get you to bring your arm down, and then I'm gonna get you to slowly bring your arm up. And as he does that, as you can see, I'm just dipping down and I'm pulling the tissue. I'm not forcing my body weight into his rib cage. I'm stretching out the tissue on either side, going up the lats and just getting a nice stretch in that area. And we'll do it one more time so you guys can see. Once again, Jeremy, we'll get you to bring your arm up at your comfort. And Jeremy is controlling the movement, and I'm moving at the rate at which he's moving. And I'm just pulling the skin and the connective tissue up. This is definitely one of my all-time favorite techniques. I think it works amazingly. And anything to open up around the rib cage is incredible, because we're actually going to talk about the diaphragm in a second and how that can increase your performance as an athlete. Just being able to breathe better and having that ease of breath will allow you to perform so much better in whatever sport that you're doing. Having the client in this sideline position is really nice for anything with the intercostals. So here I'll actually get Jeremy to bring his arm, place it around my arm, and then you can just do fingertips along this area, open up specifically along each of the ribs. You can even go down this area. So for this, I'm kind of taking the tissue. So here the diaphragm attaches. I'm taking the tissue with my fingertips and I'm bringing him towards me just slightly. And I'm spreading out in between each of the ribs. And you're feeling specifically for in between all of the different ribs. And you're looking at breaking up all those adhesions in that area. So this is one where you're gonna have to definitely work with your palpation skills and make sure you're in the right area. And once again, you can even get the client to bring their arm down, let them relax, and you can kind of create the movement yourself with the shoulder. So here, I'm encouraging his shoulder forward just slightly as I work through all of the individual ribs. And you can work all the way back close to the transverse processes. And you can do it at different angles, a little bit higher, a little bit lower. And you want to make sure that you're covering all this ground and getting a nice general overall effect for all the ribs. A nice technique for the lats, which is something that on athletes is going to be incredibly tight. I actually like to use the Edge fascial tool. So anyone who's experiencing frozen shoulder in this area, this tool is incredible. You can actually just use a knife as well. It's not as advised as something more professional like this, but you could use kind of the butt end of that to just kind of scrape in the area. So for this, I'll get the client to bring their arm up, and you're just kind of creating a little bit of specific work here. And you're just scraping along and getting in the adhesions at the attachment site of the lats. This is something that works really fantastic, and just something I wanted to throw out there as a little bonus for this course. But the main technique I did want to show you is that I'll get the client to place their arm like this, and then I'm going to place my hand down and bring him down, and then slowly bring him up, and then stretch down the lat. And as I mentioned, if anyone has frozen shoulder or lack of mobility, some sort of shoulder injury, getting the specific adhesions with the fascial tool is amazing. And then combining that with this kind of stretch is something that feels really, really good and creates more range of motion. And once again, bring it down and then slowly stretch down and work at the different angles. You can bring it down this way. You can kind of go a little more medially and bring it in. And I encourage you to think of the body as this kind of dynamic thing. You know, it's not just top down, right? You want to like create different movements, work at different angles, and make sure that you're easing off the tissue in different ways. Now we're going to get into the shoulder and neck. A nice technique that I like to do for the shoulder is, actually, Jeremy, I'm going to get you to bring your arm on your side there. And then with my hand, I'm going to control the movement of his shoulder, and I'm going to work up the upper traps and just ease off the tissue in that area. So I'll start and I'll gather and bring his arm down, and then my fist is here. Once again, light contact. You're just looking at stretching out the tissue. So as I move down and I get more into the bulk of the muscle, I can place a little more pressure. And then you can also get them to move their shoulder down as you work in. And you're just spreading up the entirety of the upper trap. And you're kind of lightening your contact as you get more into the shoulder. And you can do this at different angles. So here, I'll gather up, bring his shoulder back. And then I'm just stretching out here. And then I'm bringing his arm down and stretching out through the upper traps. And I like these techniques because you're creating the movement. The client doesn't have to do much. It's good to communicate with them and get them to do a bit of the movement if you want. But it's nice to control the movement and be able to bring it at different angles. So it's just about them relaxing. So Jeremy, I'll get you to relax your shoulder. And then as he does that, I get to create the movement of where I want him to go. And this technique is just so good for the upper traps. It's probably my favorite technique to release and to just break up all the adhesions and get a nice stretch in through that tissue.